Liz Gosen with Epic Sciences and DefineMBC, and today I'm going to share some highlights from a recent DefineMBC case with you. As a quick refresher before we review the case, DefineMBC is the most comprehensive blood-based biopsy for patients with metastatic breast cancer. DefineMBC uses a minimally invasive blood draw to analyze CTCs for ER and HER2 expression, then performs single-cell genomic analysis to detect ERBB2 amplification, and analyzes ctDNA for MSI, TMB, and alterations in 56 genes that are relevant to metastatic breast cancer. Now, let's look at today's case. Today, we're reviewing the case of a 60-year-old patient who was diagnosed with de novo metastatic breast cancer in 2016. She had bone-only lesions, and a bone biopsy showed that her cancer was ER/PR positive and HER2 negative via FISH. Over the next 6 years, she was treated with several lines of endocrine-targeted therapy, cytotoxic chemotherapy, and radiation. In December 2022, she developed progressive disease in her stomach, and in January, a DefineMBC was ordered to obtain up-to-date biomarker information. Now let's look at this patient's DefineMBC result. CTCs were detected that expressed ER, which is consistent with the patient's bone biopsy from 2016. CTCs expressing HER2 were identified, and ERBB2 amplification was detected via single-cell genomic analysis. Taken together, this is consistent with HER2 positive disease, which is a new finding and opens up several targeted therapy options for this patient. I'd also like to highlight that ERBB2 amplification was only detected on single-cell genomics and not via ctDNA analysis. Epic has presented posters at SABCS and the Miami Breast Cancer Conference showing that single-cell genomics is more sensitive than ctDNA at detecting ERBB2 amplification. This really highlights the utility of analyzing both CTCs and ctDNA in one comprehensive assay. Moving on to what was detected by ctDNA, 2 level 1A ESR1 mutations were identified, which means that elacestrant is now a treatment option for this patient. A level 1A alteration in PIK3CA and high tumor mutational burden were also detected, meaning that alpelisib and pembrolizumab, respectively, are new treatment options. In summary, there was value in getting up-to-date information on this patient's biomarker status, and no other test gives you all this information from a blood draw. Thank you for listening. If you would like to discover more, please visit DefineMBC.com or contact your local account manager.